Getting facial plastic surgery can be one of the most nerve-wracking decisions you will make. You want to enhance your face or do something that will achieve amazing natural rejuvenation that lasts many years. But at the same time, it is surgery. It's normal to be scared of surgery because getting your face cut on is a very scary idea. There's also the fear of how your recovery will proceed. I think the biggest fear of any surgery is complications. While plastic surgery of the face and neck, when performed by excellent trained surgeons, are extremely safe, unfortunately, sometimes complications can still occur despite how well the surgeon performs the surgery. Complications that can occur with any surgery include bleeding, infection, and scarring. But I think the most important complication is if you don't like the outcome you wanted. Let's talk about these complications. First, bleeding. This is a risk of any surgery. Now, we do our best to make sure the patient is in good medical health and there are no medications that predispose one to unusual bleeding, like blood thinners, ibuprofen, vitamin E, or fish oil. We want to be sure your blood pressure is not elevated. But even if everything is done correctly and the surgery goes perfectly, there is still an inherent risk of bleeding post-op. In fact, the #1 complication of a facelift is bleeding. Fortunately, the incidence is cited to be around 1 to 4%. So what happens if you develop a bleed or hematoma after surgery? There's really only one option, and that is to remove the bleeding. This can involve simply sucking out the bleed if it's small, all the way to going back to the operating room and open up the wound to find the bleeding, control it, resuture the face again. A bleed after rhinoplasty is also very rare. In this scenario, we first put pressure, we might have to inject some anesthetic. Last step, we may have to pack the nose to stop the bleed. The good news is that you will still get a good result eventually, even after a hematoma. The recovery will be delayed on that side of the face. Infection is super rare in cosmetic surgery of the face. The reason is the face is very vascular and robust. Many surgeons, including me, will give prophylactic antibiotics during the post-op healing phase. Some surgeons will debate this since there are some studies that suggest being on antibiotics does not significantly reduce the risk of getting infections. Post-operative infections usually occur a few days to a week after surgery. Common signs include increased pain, fever, swelling. If you do have an infection, then appropriate antibiotics need to be started. The surgeon may need to culture any wounds and send for studies to identify the correct bacteria or fungus that's causing that infection. Third, poor scarring is also another inherent risk of surgery, either due to too much tension or poor technique or just unfortunate healing. Any scar in the face may heal worse than ideal. A good scar should be a very fine line that's very hard to see, but sometimes a patient may develop thickening of the scar in certain areas. These are called hypertrophic scars. The most common locations I see are behind the ears or in the posterior hairline. The scar under the chin also takes a bit longer to heal. This is why a good surgeon will see you regularly. If you start to develop a hypertrophic scar, there are simple in-office treatments that can help improve these scars, like triamcinolone injections. These are steroid injections that can often soften the scar. Another option is 5-fluorouracil injections. Sometimes lasers can help improve the scar quality. Finally, if you are unhappy with the results, this can be the most frustrating result to get. In this case, it's crucial you have good relationship with your surgeon. You and your surgeon will need to have an honest, objective evaluation of your results. Before and after results must be compared. There are two main reasons why you are disappointed with the results. #1, the face or neck is still sagging or loose, or there is a puckering or skin deformity. The nose may have an obvious hump still, or it starts to twist to one side. In these situations where the photos definitively show the unwanted changes, then the surgeon should be able to offer some options to improve or solve the problem. It may mean retightening the loose area, or temporary fillers may need to camouflage the deformity. Sometimes careful filler placement can conceal a post-rhinoplasty deformity, or the surgeon may need to revise the surgery. Just bear in mind that any revision surgery often needs to be delayed many months before redoing. Doing a revision surgery too soon can make things worse because you haven't given the body adequate time to heal. The second reason a patient may be unhappy with results is, unfortunately, due to not having the right expectations established. If the photos show definitive improvement, but the patient is still unhappy, then the right expectations were not set. Ideally, this won't happen if the patient and surgeon have a good, honest consultation, and the surgeon provides an honest opinion on what can be realistically achieved. This is why when choosing a plastic surgeon to operate on your face, you really need to feel comfortable with him or her. You must be able to trust that he or she will have your best interest and only offer what is the best and safest option for you. And you must trust the surgeon will take care of any potential problems post-operatively. I see all my post-op patients multiple times in their immediate recovery. I continue to see the patients throughout the year to ensure everything continues to heal as expected. And if something is not going the way you are expecting, I do my very best to get you to be satisfied, and I will consider every option I have available to make things better. So if you like this video and it helped you, please be sure to like this video and subscribe to our channel. We look forward to talking to you again in the next video.